Right, I almost said it right, by the Director of the Office of Emergency Management, Matt Mueller, and on my left by Executive Director of the Department of Public Health and Environment, that being Bob McDonald. First and foremost, I thought it was important that we come together today to reassure you that the City of Denver is executing on its most critical function, both to protect and to prepare our residents, whether it's ahead of a dangerous storm, of course, or amid of concerns of a potential public health threat. I want to announce that I have directed the formation of a task force led by the Department of Public Health and Environment and OEM, the Office of Emergency Management, of city agencies to coordinate with schools, shelters, public facilities, medical providers, of course the airport, and other partners, which will meet beginning on tomorrow. I've also directed our General Services Department to begin installation of sanitation stations in our public city facilities and recreation centers. We just concluded a participation in a conference call coordinated by the governor this afternoon. That conference call was extremely helpful in assessing our resources and coordination efforts with the state. And we remain in very tight collaboration and coordination with the state, local agencies, and coordinating our efforts together. Our resources and our response since concerns of the coronavirus first surfaced overseas. Let me just say we also joined the governor on that phone call, along with our entire state delegation was on the line as well, and calling for support for the emergency supplemental of $2.8 billion. It also became clear during that call that there is some concern about whether or not that is enough. As a nation, we begin to work to deal with the coronavirus effectively. As of right now, there are no confirmed cases of coronavirus in the state of Colorado. Of the 23 people tested, all were negative. There are 9 pending tests today. Of those negative cases, 6 were in Denver, and we have 3 pending. There is currently no vaccine available, as you know, for coronavirus. It's important that we share with the public that we are taking the concerns around coronavirus very seriously, but it's important also that we not panic. The Department of Public Health and Environment is leading our efforts to coordinate with other local public health agencies, the Colorado Department of Public Health and Environment, and the CDC, to ensure we are sharing most up-to-date, accurate information with the public, healthcare workers, service providers, and visitors to our great state. Within city agencies, DDPHE, Denver Department of Public Health and Environment, is taking department-specific approaches in working with our supervisors and employees on safety measures that are specific to their roles and work environments. All of us need to keep doing what we know how to do to reduce our risk of getting any respiratory viruses. These include soap and water are our best defense. Wash your hands often, at least for 20 seconds. When you wash your hands, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick, and keep your distance from anyone with symptoms. And we're encouraging anyone who has a fever or flu-like symptoms to stay home. The Denver Office of Emergency Management has been focusing on coordinating preparation efforts within the city and county of Denver. This includes monitoring economic impacts and the availability of supplies. The most critical focus for us right now is ensuring that in the event of an outbreak, we maintain our essential government functions, support the ability of the city workforce to work remotely, and ensure we have all critical or any critical supplies. We're also monitoring how this virus is impacting travel to and from Denver. As you know, the CDC makes determination about where coronavirus screening is necessary. 20 airports have been identified as locations where passengers will be screened. Denver is not one of them. However, the airport has issued or will be issuing very shortly a press advisory about the regular cleanings of the facilities and take added measures to help reduce the spread of germs. These steps include installing sanitary wipes in jet bridges to allow passengers to sanitize their seats on the plane. Adding additional stations where passengers and employees can access free hand sanitizer. This includes the TSA security lines and information booths. Increasing the frequency and intensity of efforts to disinfect washrooms and other public areas with cleaning agents intended to kill germs. Train to the gates are sanitized daily. That work continues with added frequency and focus. And Den already uses passenger screening trays treated with powerful antibacterial technology to inhibit the growth of bacteria on the surfaces of bins used by travelers at the TSA checkpoints. The CDC has issued travel advisories to avoid all non-essential travel to China and South Korea, and to consider canceling non-essential travel to Iran, Italy, and Japan. Again, I want to emphasize that the city stands ready and is prepared to respond should we experience cases of this virus. But nothing is more powerful than each of us doing what we can to stay healthy, and then when we're not healthy, remaining at home. We'll open up for questions and answer right now, and Matt and Bob will join with me in answering your questions.
You mentioned supplies. Are there any places where there are things like masks, disinfectant, things like that pre-positioned around the city?
Bob, you want to hit that?
Well, it's not advised, first of all, that the general public use masks because, like you might see in a medical setting where the masks are actually fitted and people are trained to use them, you might see in other parts of the world where masks are being used, but that's not the recommendation at this time. In terms of sanitizer, that can be purchased at many retailers throughout Denver. The active ingredient is what the citizens of Denver should look for. Again, 60% active alcohol in that would be effective.
Given that there's a shortage of those things in stores around the city right now, I mean, are there places where you all have supplies pre-positioned, whatever they might be?
The city has supplies that we can position for our staff so that our staff members throughout the city are not contributing to the spread should coronavirus get here. And as the mayor mentioned, it's already out at the airport. And then we continue to monitor the private sector, private retailers, to make sure that it's still available there.
And the state mentioned that they have a supply of masks as well that will be made available to your local governments and partners as necessary.
Mayor, I wonder about the city's recreation centers. Is there any plans, as DIA is doing, to increase cleaning or sanitation in some of those places where there are a lot of people?
Yes, sir. We plan to step up in terms of the sanitation, but also to make available hand sanitizer for our employees, but also our guests into the rec centers. Yes.
If it comes down to it, where there's going to be need for quarantine or spaces for people to go if they cannot go home, let's say they are infected or they do have coronavirus, is the city preparing in any which way, kind of like what we're seeing in Seattle, attempts to purchase hotels and things of that nature to keep people quarantined? Is that something on the city's radar?
Yeah, sure. Thank you for the question. Is the city preparing for that? Absolutely. There are many places in which a person could be asked to isolate themselves. It could be within a hospital setting if they're struggling with symptoms, or it could be at home. There are many precautions that can be taken, that can be implemented in a home setting, such that it limits the spread to other family members. And then, you know, we've done this in the past where we look to extra measures in the community where we could house people who are infected or under suspicion.
So what would that look like? I mean, is that similar to like what cities like Seattle are doing with, you know, reserving a hotel or reserving space that, for instance, if families cannot stay home or if the hospitals don't have enough beds?
Those are all things that we're looking at. Certainly not something we are doing now, but something that we're preparing for if needed.
What is the criteria you look at to escalate, as Kelly was saying? I mean, what are some of the specific measures that you look at to make that next step?
Want to take that, or you want me to?
So I'll let Bob addressed the piece on the public health part, but generally when we're looking at indicators, we're looking at the economy, as the mayor said with that. We're looking at supply shortages. We're looking at impacts to our government functions. And so we have a list of 33 essential functions within the city that are core to what we do in our business processes to make sure we're meeting the needs of our citizens. If we begin to see that any of those are becoming impacted, that's when we would take a look at what are some of those triggers or some of the things that we could do to take intervention at that point.
Was the city consulted when the Physical Society Convention was canceled this weekend? And have you addressed amongst yourselves how to handle future conventions here?
You know, I don't think we were consulted. Literally, we just had minutes prior to the call a conversation with our tourism team, our representative from the tourism team, that none of the conventions had been canceled. Then within an hour, I got a call saying we just got the first one. So, you know, the conventions have to make their own determination. And obviously, we want to try to do everything we can to reassure everyone that, you know, the city's safe, we are safe, and that we have all the information necessary to convey to them. And this is why, one of the reasons why we're taking these steps now to monitor, you know, situations in Denver so we can convey that information to visitors, to our residents, and to give people confidence in knowing that if we all take the proper steps to keep ourselves healthy and to know what how this virus is transmitted, we can be welcoming for everyone.
Are there plans to protect the city's homeless population who are often in close quarters and shelters
Yeah.
and camping?
Yep.
Yeah, we have plans to protect everyone who is in the city of Denver, including the person struggling with homelessness. And we are working closely with our shelter providers to educate them on what they should be looking for. We just a few days ago launched our first public health mobile unit, and we will be dispersing information off of that mobile unit to those experiencing homelessness, and also hand sanitizers. We also have restrooms that are made available, not just in shelter settings, but mobile restrooms that we can move around where we need them, all designed to limit the spread.
Could you speak to just the volume of those things as far as how many people, you know, you're preparing to help?
Well,
How many things you're preparing to
well,
give out?
we're preparing to help everyone. How many people will, you know, contract coronavirus and ongoing supplies necessary to meet that demand? That's what we prepare for closely with the Office of Emergency Management. So we're prepared to ask the state and the federal government for more supplies if needed.
How, if at all, are you coordinating with first responders that come in close contact, whether it be with the homeless population or just anyone for that matter who might call 911 for help?
Those conversations include not only the individuals experiencing homelessness, but also our staff and community folks who are coming in contact with people experiencing homelessness. It's for everyone. And so our conversations and our thoughts have been broad. Richard Sharp, why don't you come on up here? Our executive director of Visit Denver has just walked in. So they had a great question around tourism. But so the idea is that we're not just taking a single approach. It's everybody involved in that entire apparatus. Okay. Richard, there was a question about communication with potential conventions, and particularly the one that just passed. Were you consulted early, and were you taken off guard by the call?
Actually, we were taken off guard on Saturday evening when they decided to cancel. But today they have met with the convention center and all the hotels that are involved. And we are working closely, communicating with all the stakeholders, the mayor's office, our hotels, the convention center, the airport, state and Denver Health Department. We are also fielding a lot of calls from our incoming conventions. Obviously, we're in close touch with all the ones coming in this year. They are mostly concerned just about Denver's preparedness plan, which we have a pretty solid plan in place. And so we are continuing the communications to our existing customers that are coming in, and also with our hotel properties to make sure that we're all on the same page.
So was there any, from the conference call today, has the city changed anything as a result of today's conference call? Was there any procedures that changed? Or?
No, absolutely no. And I was pleased to have the entire delegation on the phone because we got a chance to also talk about our requests, well, the entire nation's requests and the president's efforts in terms of the emergency supplemental funding. But nothing on our part that we need to change. Actually, we found that we are quite in step with what's going on in the state and with the state. and pretty well coordinated. And this is, I think it's important to note that, and Bob said this earlier with our executive team, it's about a plan, but it's more important to talk about coordination, that we're talking to our hospitals, our schools, our partners, regulated agencies, that we are sharing information about what we know and making sure we are coordinating those services and monitoring things like the economy. You can't have a 10,000 person convention council and not have an impact economically on the city in terms of our hotels, our restaurants, our entertainment venues. So that stuff is important that we stay on top of that. But more importantly, as we're coordinated, how do we coordinate our messaging so that the people, the residents of Denver, the people who work in our city, get the right information at the right time, and that we're all on the same page as we share that information, and we can keep people, reassured that their city, their county, and their state are on top of this issue.
And I've already seen supply lines and economic pipelines have been interrupted. Has Denver seen any of this, or are there plans to deal with that?
Well, again, I'll mention the convention was a big one, and as we continue to keep information in front of our pending conventions, I think that's going to be critically important. Supplies are important because I think that Bob, and I'll bring him back up here to mention this, as people are, getting more and more concerned, what should they be doing to prepare? And so maybe you can talk a little bit about that in the event that there's a spread.
And maybe talk about the goods, things for like the economic drivers of the city, some businesses and things that might be, their supply lines might be interrupted.
Well, I cannot overestimate the importance of personal hygiene in controlling this, in controlling this virus. The best tool that everybody has is themselves, being aware of washing their hands, touching their face, taking reasonable and appropriate precautions when in travel, being aware of their surroundings. Immediately upon coming down with any symptoms associated with this, or just being ill in general, they need to refrain from going to work and make sure that it's safe to go back to work after their illness has subsided. But in terms of the most important supply is soap and is water. And everybody has access to those and should be washing their hands frequently throughout the day, even not just before they're ready to eat, but throughout the day, before they touch their face, certainly before they eat, frequently when in travel. Those supplies that people need to wash their hands are widely available.
Do we have enough money to handle this, and where's it coming from?
Yeah, right now yes, we are within the scope of our fiscal constraints, I should say, and our budget. But obviously, we have a supplementary process in Denver. If indeed we have some departments or agencies that go over their budget because of this, we have a supplemental set aside, our contingency fund set aside that we can dip into. But God forbid that happens. We hope that we can do this within the confines of the budget that we've set up. And we have the state and federal government to partner with as well.
You talk about messaging. What's the city doing to make sure people are getting accurate information?
Talk about the link.
Yeah. So that's an excellent point, because a lot of this is all about messaging. On our department's website, Department of Public Health and Environment, we are updating daily what's happening at the local level. Our department, Public Health and Environment, is activated our Department Operations Center. That will be 24/7, and that's activated so that we can monitor what's happening locally and what's happening across the country. We're pushing educational information out through our website, out through the field work that we do, and all the regulated facilities that we're in, answering questions on a daily basis, putting information out through the Denver Call Center, pushing information out through the Wellness Public Health Unit that we launched earlier this week, social media, just a wide range of information and avenues to get it out there. Of course, anybody with questions can contact our department, call 311. There's a number of ways in which people can reach us if they have questions.
Mr. Mayor, I wonder if you and your family are doing anything to prepare for a possible outbreak?
Well, you know what, I shake a lot of hands during the day. And so we have stocked up on our hand sanitizer, and Bob pointed the hand soap with a 6% alcohol base, which is, I think, extremely important, something I was not aware of. But we encourage people to do the things necessary: soap, water, hand sanitizer, 6% alcohol content, and bottled water. which is another thing that I hadn't thought about. But we try to keep as much bottled water at home as possible.
Mr. Mayor, not that you want this to happen, but if it came down to it, what power does the mayor's office have to curtail business or public spaces, things like that? Is that in your hands? Is that in the governor's hands?
No, in the city of Denver, we have the ability to, in partnership and consultation with the public health officer, Bob McDonald, to restrict areas that we deem might be a public health threat. And so we can do that. But we will do that, I'm sure, in consultation with the state public health department as well. But Bob is our public health officer, and so he and I will be in close consultation when issues are arising, and he will advise me as necessary and what we'll need to do necessary.
And what's the best one-stop shop to get information if you're a resident of the city?
denvergov.org/DPHE for Department of Public Health and Environment. And on our website, again, you will see local information. I'm sorry.
Sorry to interrupt, we put it on the homepage of our website, so they'll be able to access
Okay.
it right on Denver.
Okay, denvergov.org. Okay, so you can access the city's homepage. It's certainly on our homepage for the Department of Public Health and Environment. And again, within the DPHE is a link to CDC's website, which has broader information about what's happening throughout the world and throughout this country. And travel advisories can be found there too.
What power does the state or city have to detain an individual that may
Take that.
quarantine?
Well, we absolutely have the authority to do that, and we've been doing it for people who are under suspicion. We have quarantined them, isolated them, issued orders for that. Everyone has complied with those orders, and everyone came out healthy. It wasn't necessary to take any further steps.
So is there a protocol? Sorry, is there a protocol if what happens? Somebody tests positive, then what? What's the protocol? One person, 10 people, 20, is there, then you could give?
Well, the orders that we've been issuing are for people under suspicion. So people who have, most recently, somebody who came back to Denver from China. We issued an order to isolate them, to monitor them, and the person did not contract coronavirus. So that authority is there. We've used it a dozen times or more. We'll continue to do it. And then, our healthcare providers can also restrict people, give guidance in terms of what they need to do at home. They can be isolated at home. There are a number of ways in which that can be done, but the city has absolute authority to issue those orders, and we've been doing it very successfully.
What are the consequences if they don't? What happens if you don't obey an order?
Well, that's unfortunate if that happens. Yeah, certainly we follow up on it to make sure that they are complying. There's some very broad authority with the Department of Public Health, and we can take enforcement anytime someone fails to comply with an order issued by the Department of Public Health, but that's not our goal. We want to isolate them, educate them, monitor them to make sure that they comply. If somebody didn't comply, we would want to make sure that we address the barriers that keep them from complying with an order to stay at home, and we would follow up on that.
Is there any protocols, and I simply don't know that someone here would go to Fort Carson, or is that a national? Right? I mean, Fort Carson has been identified as a place where people might go to be quarantined.
Well, we have not had to do that. Is that a possibility? It could be in the future, but we've not had to do that at this point, not from our department.
Maybe one more question?
I would just add that medical experts are telling us that the flu is a much bigger concern, yet here we all are talking about coronavirus. Does the city feel any responsibility to prevent an overreaction, and do you feel that the community is overreacting at all?
Bob can jump in here, but I don't think the residents are overreacting. I think it's appropriate to ask, what are we doing in the event to prepare for potential presence of the virus and potential spread of the virus? So I think it's very important for us to be doing what we're doing now, talking about it in the public sphere. What do we do to prevent it? Making sure everybody has what they need to prevent it, starting with information. And one of the things we find out to help guard against spread is the very basic thing that we all tend to have access to, soap and water. And that will help us do a better job in containing the spread of this virus in the event that it comes to our city. Okay? Any other questions? Thank you.
Could you your numbers one more time? You said
Yep.
there were 9 cases pending, or test results pending, is that right?
3.
3.
No, let me make sure. Let me make sure I said it. I may have said 6. Hold on. You're taking me back. So far, 23 people have been tested. All were negative. 9 are pending. You correct. Of those negative cases, 6 were in Denver.
Of those negative cases, not of the 9 pending.
Right. Of the negative cases, 6 were in Denver. 3 pending are in the city of Denver.
Okay, thank you.
Okay. Thank you all.